Have you guys ever thought about the kind of diagnoses and the kind of disease processes that can be served on hospice care? Because it's not just cancer. I used that for an example, and I know I used heart disease as an example, but hospice can serve any disease process, even if it's not a disease process, anything that is likely to cause the end of your life within 6 months' time. And you know, honestly, I've had people ask me, well, how come it is that someone can be 98 years old and tired and wanting to be on hospice care and you can't take them on hospice? Well, just because you're 98 doesn't mean that your body says in 6 months from now I'm going to be done. There's still a lot of life left in folks who are 98 years old, and we've seen that. And we've seen families want a patient on hospice care, but it's just not possible to do that with criteria just based on age. Now, however, there is the possibility to serve people who might not have cardiac problems or pulmonary problems or cancer or Parkinson's disease. We can serve them when their body just kind of begins to shut down, and they have a word for that in hospice where, you know, you're losing weight, you become very weak, and you can't function anymore, you can't take care of yourself anymore, and you have a really pretty rapid decline. And that is something in hospice care that we will evaluate, and we can typically serve people that way too.
And what exactly would you do when you come in, right? What do you do when you come in the home? What do you do?
That's a good question. Usually within 5 days, you will meet your entire team. Your nurse will come first and do what we call an admission. And during the admission, basically, it's a conversation. What is it that you want from your hospice program? Here are some things that we can do. Here are some expectations that you can have of us. Here are some expectations that we have of you. We also have a social worker and a chaplain and a home health aide, like I said, who will come in and meet with the family. But some of that, yes, the home health aide can do some of that. Our nurse will make regular visits. Depending on what the patient's needs are, the frequency of the visit will vary. Typically at the beginning of service, unless there's, let's say we have somebody come on who has COPD. If you've ever worked with someone or know somebody with that disease process, it's a very difficult breathing symptom often that they have. And so maybe when they come on hospice care right in the beginning, we need to see them more frequently to get those symptoms under control for them. And then when things settle down a little bit, for the nurse anyway, when things settle down a little bit, we wouldn't see them quite so frequently. And maybe then it might pick up a little bit and the nurse would have to come more frequently. However, during the time maybe that the nurse doesn't have to visit so frequently, maybe there are end-of-life wishes that that patient or that family might have together that we would begin to work on with them. The home health aide, let's say the patient can't bathe themselves anymore. The home health aide could come in and bathe so that the family didn't have to do that. Yes, some meal preparation if the patient is there themselves and that's a hardship, and the home health aide can then maybe prepare a small meal for them and clean up after themselves and maybe do some light housework. Hospice does not come and provide 24-hour care. That is something that through our private care service can be hired if people want to supplement their hospice program.
But the other is covered by insurance?
Hospice is covered by insurance, yes. Private care is not.
Okay, but the other is considered specialty?
You mean the hospice? Hospice is a specialty care, and it's recognized by Medicare. Medicare will pay 100% of your hospice program. And what that includes is your entire team of staff. The other thing that includes, hospice is paid by the day. We don't get paid by every nurse visit. We don't get paid by every home health aide visit. We don't get paid by each thing that we provide. Can you still get me if I go closer this way, because they're having trouble hearing? We get paid by the day. So Medicare says, I'm going to give you so many dollars every day to go provide hospice care for Josephine. So when we get there, Josephine's equipment that she needs, let's say she can't get in her own bed anymore and she needs a hospital bed. Hospice will provide that hospital bed. Let's say Josephine needs certain medications for her COPD, and that's why she's on hospice care. Then hospice then will pay for those medications for her out of whatever the insurance company says, this is how much I'm going to give you each day. It also does cover the nurse, the social worker, the chaplain, you know, our medical director, those kinds of things. So all of the durable medical equipment and the pharmacy related to the diagnosis would be covered also under the hospice program. But each person's care plan is what we call it, is developed with the patient and family. So it's very individualized. It's hard to say that when I go in Josephine's home, her program is just going to be like maybe we go see James 3 blocks over from Josephine, his program's going to be completely different. And maybe the number of visits that he gets by his staff is completely different. And let's say maybe Josephine is really struggling spiritually, and what she really needs is more frequency from her chaplain and for him to coordinate with the pastor that Josephine's been missing and hasn't seen in 10 years. And so he'll set that up, and then we'll work on those issues. And maybe it's physically for James. We just can't get his breathing under control, or he has pain that we can't get rid of or we can't minimize for him. So it's very different for everyone. Hospice is certainly not a cookie cutter program at all. And with us, it's a very individual plan that your team comes in and sets up with you and with your family.